Melanie Palm from Artist Skin MD in Solana Beach, California, and I'm getting a little ab workout.
You are, as we're chatting.
I'm joined by the illustrious and uber-talented Rickie Hoppe, who's one of our two body contouring experts. And so we thought we would talk about EMSculpt, Neo, a little bit, and then talk about the importance of maintenance therapy.
Agreed.
So, because I am in maintenance therapy, I did a couple of these prior to ski season because I wanted to keep my core really strong, which I think went well. I'm intact.
Yes.
Head's intact. ACLs are
That's
intact.
very important. We need you
Core
here.
kept me strong. But maybe for those who haven't seen EMSculpt, why don't you talk a little bit about what EMSculpt Neo is and how that's different from the original EMSculpt machine?
Absolutely. So EMSculpt Neo uses radio frequency and a high FEM technology. So it has, obviously the regular EMSculpt doesn't have as much of the radio frequency because this is getting a little bit of fat reduction, and we're also getting that strengthening of the muscles as well. So that's the Neo portion, as you can probably see here on the front of the machine. We love this treatment for someone who just has kind of a little bit stubborn area in the abdomen area. Probably not too much, pocketed fat in the area, but just a small, area of trouble per se. But we love it for the muscles. So like she said, she's been skiing this last winter. Obviously you're using muscles that you never probably use, and it can affect your lower back. So this is great to kind of strengthen that abdominal area to help with lower back pain. Obviously get that definition that a lot of us strive for, with hormones, age, post-pregnancy. If you struggle with the diastasis recti, that separation of the muscles, it can help bring those back together, which is amazing.
So right now we're, this is one of the treatment paddles or applicators, and we can treat lots of different areas on the body.
Yes.
So, some of our athletes, we treat quads to get them stronger if it's something like ski season.
Absolutely.
We're treating my rectus abdominis muscle. So what we refer to as the 6 or 8 pack is that group of vertical abdominal muscles. But we also have the edge. So maybe explain that as well to the audience.
Absolutely. So I guess that's our newest applicator. It's not new per se. It's been around for a couple of years, but it's newest to us. So the edge basically treats that the lateral flank area. So we have our abdominal muscles, and then we have our lateral
obliques.
Our obliques, exactly. Flank. That's layman's terms. Sorry.
Okay, we like to say both.
I like to have layman's terms too. just to make it clear for everyone. Targeting kind of our oblique area that basically is, we consider it the flank. The area that kind of may hang over the top of our pants there. Obviously for our muscles, how we address kind of that lower back area as well, so strengthening that. So sometimes we have patients actually do the abdomen, and then they do a series of the edge as well.
And oppositional muscle groups too. So our biggest core muscles are one of our strongest, if not the strongest, is our gluteus muscle. So we decided Dr. Palm should not twerk on camera.
Not doing her booty today.
We're not doing the booty today, but I often treat the rectus abdominis muscles in conjunction with the posterior chain and our strongest muscle, the gluteus medius, maximus, and minimus. So we were involved actually with the gluteal study where we did MRI imaging of our patients that were receiving EMSculpt Neo treatment. And what is really cool is, regardless of the multiple studies that have been done with EMSculpt Neo, it doesn't matter the BMI of patients, the geographic location of patients, or even the area of the body that we're treating. Across the board, with the 4 treatments that were standardized in the clinical trials, we saw a 30% reduction in fat if that's what we were trying to do. So in areas such as the abdomen or the obliques, where we're trying to sort of whittle away at the waist and strengthen the core. And a 25% improvement in muscle mass. And this was an objective measure. You can't lie looking at baseline MRIs, measuring the thickness of these tissue compartments, lining it up at the same sort of vertical. So that is really impressive to me.
Absolutely. I mean, those numbers are huge, right? Without going under, using the knife, doing anything aggressive per se.
I was doing a body composition assessment with my trainer, and I had never done one of those because I wanted to understand what's my muscle composition, what's my fat composition. It even measures your visceral fat, which that is the fat that's below our abdominal, behind our abdominal muscle group.
Yes.
It's what encases our internal organs. So it does play a protective role, but
you probably don't have much.
Well, and I'll tell you how much I have.
I'm curious.
The visceral fat, especially at high levels, can be a high probability predictor for cardiovascular disease, atherosclerosis, chance of a myocardial infarction, which is heart attack. So our goal is always to have low visceral fat. And so mine was 3%, which we were all jumping up and down for.
Yeah,
but what's interesting is even though EMSculpt is not directly treating visceral fat, it is just going after this subcutaneous fat compartment and the muscle that's directly underneath it. There is a role in what this is doing. When we build muscle, you start to affect free fatty acid metabolism. And when you start to change the ratios of muscle to fat, you actually reduce some of the visceral fat. So when we looked at some of these past studies, the MRI studies, and looked at visceral fat, they saw a reduction in visceral fat as a byproduct of building more muscle.
Right.
And as we've talked about on past broadcasts, sarcopenia is a real thing. So that is loss of muscle mass over time.
Absolutely.
It starts to happen in our third and fourth decade. And doing muscle strength training is a really important role of that. But we are super maximally contracting the muscles with what we're doing right now. So when every time there's a pull strain, which
as you see, I mean, I wish I had the camera, I could take it closer, but you can visually see how it's lifting and contracting her muscles.
And it's beyond what the very best personal trainer can do in the very best circumstances.
Right.
So, it's interesting. I was chatting with some friends, and one of them has this device, and they went to see a celebrity. And this person had an EMSculpt, and that is how they look so amazing in their action blockbuster
I would not be surprised.
movie. And you wonder how the Victoria's Secret models get those phenomenal bodies. Many of them have gone on, and they're doing that. So, yes, there's this amazing aesthetic benefit, but what I really enjoy is feeling stronger. I'm going to go to yoga class tomorrow, and I'm sure I'm going to be doing lots of downward dogs and planks in my vinyasa yoga, and I feel a functional difference.
Absolutely.
So, talk to the audience a little bit about how do you decide how many initial series of treatments you need, the frequency, how long it is, and what do you like to do for maintenance?
Yes, absolutely. So typically we suggest a series of 4 to 6. So that's upon evaluation with one of the consult, the body consult artist here. So we'll decide that initially. Typically people do 4, but sometimes we see, depending on what people's goals are, where they're at, like baseline, we'll decide that. So we'll decide that for you if you come in for a consultation. And we do suggest it's, you can go between 5 to 7 days. That usually marks you around the 7-day point. So people typically come once a week for this. So if you do a series of 4 within a month, you'll be done. You do a series of 6 within a month and a half, you'll be done as well. So it's nice because that's kind of in retrospect a short period of time. We do always say, you have to be patient with your results. What my patients feel most is they do feel stronger. So after their first treatment, they're not going to look in the mirror and be like, oh, I have a 6-pack. That's kind of unrealistic, but they'll feel better in their workouts. I remember I did my glutes and I was actively going to the gym and I actually felt stronger, after this baby. I will definitely do my abdomen as well. So results, aesthetically kind of take time. So usually 3 months after your series of 4 or 6, we do photos and we kind of see where you're at. But like I said, people feel that internal strength. If they go on a skiing trip or they're at the gym or just yoga, whatever they're walking, their postural almost feels better, everything. Series of 4 to 6, once a week we do that. Maintenance is what I really wanted to talk about today because I know Christy and I are really adamant about discussing that. I don't know if everyone's that way, but I like to say just like working out, right? You're going to work out for 3 to 6 months, have your goal, hopefully start to see your results around that 3 to 6 month point. If we just stop working out, eating horrible, we're going to go back to our baseline. So like this, we get our results, we see our results at the 3 month point, but we do suggest maintenance treatments. So I usually suggest, and I think Christy's on the same page, between like a 3 to 5 month point to do one treatment. Sometimes I say that and people are like, oh, do a series again? I'm like, no, you just do one treatment every quarter, per se.
Yeah.
And so our little pro tip as the providers here is like during body boot camp and some of our, specials we have, you can purchase a package, and if you're at that point to do your maintenance treatments, use it, so get it at our discounted rate, which is always nice. And then space it out every quarter, and that package of 4 will last you a year.
And if we have some patients that are so thrilled with things, you can do it once a month. If you
absolutely. I mean, I'm not going to say no to that, but
we know from clinical studies where they did imaging, so MRI studies, and looking at patients without retreatment at 12 months, they actually maintained the 25% muscle mass gain. But I do feel that like a little bit of loss of strength. So I think I am one of those that I try to do it quarterly to maintain. And I think you've got the right tenets. Other tips that we tell patients, while I'm doing this abdominal treatment, I anticipate the pulse train and I actually contract my rectus abdominis.
That's always your tip, but I love that. I've been saying that to all my patients. I've been doing this for over a decade, but I love that tip from you personally. That you go ahead, you almost contract those muscles while it's going,
and you can see it's a comfortable treatment.
She's not in pain.
No, I've been sitting here talking. I'm definitely not the bravest patient, but it's a funny sensation the first time you do it because your muscle is contracting without you voluntarily doing it.
Right.
But I mean, we've got a big TV behind the camera. People just watch whatever show that they want to,
or rest. I mean, if we weren't here doing this, we could dim the lights. You could take a little rest, which maybe you would do, maybe you wouldn't. But we have those options. So it is a 30-minute treatment. So you can do it over a lunch break. You can do however you can squeeze that in within your day. But it is very comfortable. And I do like to tell my patients, like, I think for anyone that initial treatment is always kind of like what to expect. So like Christy and I, yourself, we can explain things in depth because we've all been doing this for decades. But I think it's just that initial feeling. So I would never explain it being uncomfortable. I'd say it's just a different sensation, right? The warmth feels great, like a warming blanket. It's just we don't normally contract our muscles. You can do 100 sit-ups and you're not going to feel, as strong as it could be. So no really discomfort, just a different sensation. But by treatment 4, people are like 100%. Right away.
That was me.
That was you. She's like, Rickie, come on, hurry.
Let's go. I'm not joking around. And then the other 2 tips that I talk to patients about is the radiofrequency portion of this. Not only can we use it to tune fat reduction, but it helps gently warm the muscle compartment so we get more muscle effect as a result of this. So radiofrequency works best in hydrated tissues. So it is important to keep up your hydration previous to your treatments and do that during your treatment sessions.
Pre, during, after.
And then finally, I talk to patients, so we cannot build tissues, including muscle, without adequate protein intake. So making sure that you are talking to your provider, whoever is sort of in charge of your general health, about adequate protein needs for your age, body composition, weight. I think that's really important if we're trying to build muscle tissue. Most women are woefully under-consuming the amount of protein we need on a daily basis. So really being thoughtful about that so you can maximize the amount of treatment and the amount of muscle building that we're going to get from a series of treatments. It is incredibly important.
Plays a role. And I do feel like that makes us unique, those little tips we give, because, not everyone, we had a patient this morning, we're thorough, we care, we will take the time to give you those extra tips to maximize your results. So I love those tips, and those are always things to consider. Christy and I will reiterate that again during a consultation, but I definitely think that's super important.
And we're keeping it classy, San Diego, so Dr. Palm is not doing your booty on camera. No one needs to see that.
We like to keep it classy here. I'm not sure.
But I think, just timely, we're sort of in late spring. We're going to hit May, gray and June gloom. We've got a couple months if you're sort of getting your summer bod, but I think if you're someone like me that puts an importance in a healthy lifestyle, wants to really enjoys what they do and wants to stay functionally active as long as they can, maintaining muscle mass is so important to having a healthy lifestyle and a really productive life. And so I think, you know, as much as we love the aesthetic benefits from this, for me it's about feeling strong and capable, having amazing posture, and being able
with your
to
jaw
enjoy
and just everything.
the activities that I do. So we really thank you guys. We hope this has been educational. And if you have interest in other areas of things that we're doing in clinic that, you know, maybe we haven't covered, you know, pop a message in. We're happy
always.
to do that.
Christy and I would love to do these lives with her. So if you have anything we want to focus on or go in depth, we'd love to answer your questions.
And we are here now on Fridays, as you can see. Rickie,
Monday through Friday.
Yep, and Christy are alternating Fridays, so we have somebody here, which I think patients are loving going into the weekend. And also, I think really lovely is that you guys offer complimentary consultations so that you can take the time to really address patients' needs, do a proper evaluation, see what is possible, because we often combine this with fat reduction strategies that are non-surgical and minimally invasive. And this is kind of the big pièce de resistance, I think, after we've sort of debulked unwanted fat. So.
Oh, absolutely. And this is the time to do it, too. I think we've reiterated that a couple times because we have a little bit of those gray months coming. So if you're, you know, wanting to feel a little more confident or even stronger during summer, if you're out exercising outside or something and you want that little bit of, you know, strength, let alone confidence boost, this is the time to do it, right? Because we usually see our results in about 3 months or so. And then even before then, you're starting to feel the strength. So this is a good time. That's why we're focusing on it right now.
So we
don't want to take
bid you guys adieu. We hope you have a wonderful weekend, and glad that you guys got a nice sort of reintroduction to, I think, a technology that we just absolutely love in clinic. So I'm going to have Rickie, since I'm under the machine.
You can knock it up and run a lot of you have 10 minutes.
But thank you guys for tuning in, and hope it was a nice educational experience for you all. And we will see you next time for another Art of Skin MD Lunch and Learn, okay? I think it's in the top right.